So the first and the most important test that is done is known as the perimetry. It is also known as the visual field analyzing test, where we check what is the amount of nerve damage that has happened. It will check your visual fields almost about 30 degrees. So this is done on mostly two types of machines. One is the Humphrey perimeter and one is the octopus perimeter. So perimetry holds a very, very important role in the diagnosis, in the treatment and decision making as far as glaucoma is concerned. And this test may be repeated every 4 months, 6 months or once a year depending upon the severity of the disease. Now, it basically acts like the report card of your nerves. So, the test would tell us how much damage is there, and that helps us decide that how much lower the eye pressure has to be gotten to. The second test is pachymetry. Now, what the pachymetry exactly is, it basically tells us what the corneal thickness is. So, cornea is that part of the eye where your eye pressure is measured. So, if your cornea is on the thicker side, that means we are overestimating the pressure, and if the cornea is on the thinner side, we are underestimating the pressure. So corneal thickness is important, called the pachymetry. Then, like I said, glaucoma is a disease where the nerve is damaged. So the perimetry tells us the functional damage, and we have another test that is known as the OCT that will tell us about any structural damage that is done to the nerve. That test we do repeat maybe once a year or once in 6 months, depending upon the stage of glaucoma. So step 1 is that there are drops that are available. We've got about 5 molecules available with us. So initially your doctor will start you on drops. The second one is lasers. In angle closure glaucoma, laser treatment is done to reduce the eye pressure so that the angle within the eye sort of opens up. And also even in open angle glaucoma, we can do a laser that is known as selective laser trabeculoplasty that will reduce your eye pressure. So we have drops, we have lasers, and we have surgery. So the first type of surgery that is available with us is the gold standard performed worldwide, that is known as trabeculectomy. Trabeculectomy is a procedure wherein a bypass area is created for your eye pressures to be kept under control. And this surgical procedure has been in for 50 years and it is tremendous success also. Now step number 2 is that in certain cases we know that the traditional surgery is not going to work well, or if a patient has already undergone the surgery and still the eye pressure is not under control, we put in tube shunts within the eye to control the eye pressure. We have specialized stents that are available that are known as MIGs that are being performed to control the eye pressure. So there are various procedures that are available to reduce your eye pressure in the form of drops, lasers and surgery. What we must know about glaucoma is that whatever vision is lost because of this disease cannot be recovered. So even if the patient is on drops, even if the patient has undergone surgery, this vision, if the patient has significant amount of vision loss because of glaucoma, that can't be recovered. So it is basically an irreversible disease. But that does not mean that we do not take treatment, because we know that the disease is going to progress as you age. So we know that slowly the vision loss can progress if we don't keep the eye pressures under control. So if we need to preserve vision, we need to keep the eye pressures under control, be it in the form of drops, lasers or surgery. And it's a continuous process. It is a chronic disease. It's just that the treatment and the goal lies in preserving vision and unlikely to get vision back.